As the COVID-19 vaccine rollout ramps up around the globe, Johnson & Johnson reports its one-shot candidate isn't as effective against the disease as its two-shot counterparts from Pfizer and Moderna. But with the options growing and COVID variants to consider, what should people watch for? Will it even be a patient's choice what vaccine they receive? Let's ask Fox News medical contributor Dr. Nicole Saphier. Doctor, thanks for joining us as always. So first, if you wouldn't mind speaking to the efficacy of the Johnson & Johnson vaccine, and then along with that, of course, goes the big question, which people always ask is, which one should I get? Do I have a choice? And how does this all play out?
Well, there's a lot of questions going on with the vaccines and the circulating variants, Jedediah, but I think it's really important to talk about the variants before we get into vaccine efficacy. So viruses mutate naturally, and actually it's completely dependent on human behavior. The higher the viral transmission in the community, the more chance it has to mutate, which is why we have so many variants now circulating the globe. Many of these variants are showing to be more contagious and also being able to carry a higher viral load in people, which can lead to overwhelmed hospital systems, as also increased disease severity. Now, when you take that and you look at the efficacy trials coming out of these vaccines, Pfizer and Moderna had the incredible over 90% efficacy during their late-stage trials, and now Johnson & Johnson has come out saying their single-dose shot has had a 66% efficacy. However, we can't compare these apples to apples, Jedediah, and that's because these vaccine trials were done at different times. When Moderna and Pfizer underwent their clinical trials, they had far fewer variants circulating as opposed to Johnson & Johnson, Novavax, and even the later stage AstraZeneca trials. So that may explain why they have a lower efficacy, because even Pfizer and Moderna are saying some of these variants are not responding as well to their vaccines. The great news, though, out of Johnson & Johnson, not only is it a single dose shot, easier to transport and administer, however, they did show that there is 100% efficacy in preventing severe disease after about a month and a half. That's big news. And so we have to keep things in context. We don't know what the current efficacy of Pfizer and Moderna are in large scale with these current variants. So they're all going to probably be similar. Any vaccine you can get your hands on at this point is the one you should be getting.
So there's a lot of concern about these different strains we keep seeing in the news. There's this new one from South Africa that is concerning some. What do you know about it so far?
So B.1.352, the South African strain, has a similar mutation to one that's also being followed out of Brazil, which is called P1. These are the variants that we're really interested in. There's many variants of concern circulating right now. There's the UK one, there's a couple actually in California, but those seem to just be a bit more highly transmissible, and the vaccines seem to be conferring immunity to them as well as previous infection. The South African strain, the Brazilian strain, as of now, we're showing some lab data as also clinical trial data that the vaccines and even previous infections may not be giving immunity to these new variants. The Novavax trial, interestingly, showed that people that were getting COVID-19 again, many of them actually had a prior infection with the the preceding strain.
I hate to interrupt you. Unfortunately, we're going to have to
causing reinfection.
Wrap for
so
today.
That's concerning.
I appreciate it. But we're going to have you back to expand on this, okay? No worries. We'll be right back with more Fox and Friends on the other side.